Constipation is a very common problem among dogs and cats. Afflicted pets are unable to evacuate their bowels fully or comfortably. As a result, they tend to pass feces less often or in smaller amounts than normal. Constipation in dogs may be very common, but it's by no means as common or as potentially life-threatening as it is in cats. Cats that experience this more life-threatening version of constipation are said to suffer from a process called obstipation. The following are well-recognized causes of constipation. Number 1. Blockage from foreign materials, for example, hairballs or ingested toys. Number 2. A behavioral reluctance to defecate, in case of dirty litter box or unwillingness to go outdoors due to weather conditions. Number 3. Pain around the anal area. Number 4. Decreased or insufficient exercise. Number 5. Decreased water intake. Number 6. Dehydration for any reason. Number 7. Inflammatory diseases of the intestinal tracts. Number 8. Nerve damage. For example, in case of intervertebral disc disease in dogs or trauma. Number 9. Back or hind limb pain, making it painful to squat to defecate. Number 10. Tumors. Number 11. Drugs, including anesthetics or opiates. Number 12. Trauma, leading to pain or diminished nerve function. What are the symptoms of constipation in pets? Constipation will often be readily identified by owners who routinely monitor their pets' elimination habits. Observant owners may note one of the following signs: straining to defecate, production of less stool than normal, defecating indoors in dogs or outside of the litter box in cats, passing small amounts of liquid stool, vomiting, lack of appetite, depression or lethargy. Additionally, veterinarians will often be able to palpate the pet's abdomen to identify firm feces in the abdomen. An X-ray is sometimes necessary to identify the problem and assess the degree of constipation involved. Treatment varies widely depending on the severity of constipation. Here's a list of the most common medical approaches of constipation. Number 1. Adding dietary fiber is a common recommendation. Psyllium, metamucil, canned pumpkin, or wheat bran are routinely suggested options. Unfortunately, it's likely that this approach is only mildly effective. Number 2. Lactulose is a non-absorbable sugar syrup that helps draw water into the colon to help moisten dry stools. This is considered moderately to extremely effective depending on a patient. Number 3. Hydration via intravenous or subcutaneous routes helps moisten the tissues too. Number 4. Medications to help improve the movement, like bicycodil and senosides or senna. Number 5. Petroleum-based stool softeners, often marketed as herbal remedies, are popular as well. In addition to the standard medical approaches, are a slew of more instructive techniques that are often required. Number 1. Enemas, in particular, are typically employed when medical therapy is insufficiently effective. Number 2. Newer techniques that offer a special polyethylene glycol solution through nasoesophageal tubes are also available, though typically only in specialty settings. Number 3. An anesthetic procedure in which pet's colon are manually evacuated is usually considered a very common last resource in the case of intractable stool impaction. Of course, addressing any underlying disease that may create conditions that lead to constipation can help as well. Further, it's important to note that if this problem constantly recurs, surgical intervention may be the best approach. A procedure called a subtotal colectomy is the gold standard for treating the very most severe cases of constipation in companion animals.